While caring a child with leukemia, a nurse should look for all of the following except A. Weight loss, B. Weight gain, C. Weakness, D. Shortness of breath. And the correct answer is B. Weight gain. Weight loss, weakness and shortness of breath are all symptoms of leukemia in children, whereas weight gain is not seen in children with leukemia. Vector of malaria is A. Infected male culex mosquito, B. Infected female anopheles mosquito, C. Infected sandfly, D. Infected female culex mosquito. And the correct answer is B. Infected female anopheles mosquito. Female anopheles mosquitoes are the definitive hosts of Plasmodium parasites, the causative agents of malaria. These mosquitoes become infected when they ingest a blood meal from a human carrying Plasmodium gametocytes. PPTCT is a part of which of the following national program? A. National AIDS Control Program, B. National Vector-Borne Disease Control Program, C. National Leprosy Eradication Program, D. National Program for Control of Blindness. And the correct answer is A. National AIDS Control Program. PPTCT stands for Prevention of Parent-to-Child Transmission. This program aims to prevent the perinatal transmission of HIV from an HIV-infected pregnant mother to her newborn baby. PPTCT program includes counseling and testing of pregnant women. All of the following diseases are covered under the UIP National Programme except A. Tetanus, B. Diphtheria, C. Hepatitis B, D. Enteric fever. And the correct answer is D. Enteric fever. UIP stands for Universal Immunization Program. The diseases which are covered under Universal Immunization Program are tuberculosis, diphtheria, pertussis, tetanus, poliomyelitis, measles, hepatitis B, diarrhea, Japanese encephalitis, rubella, pneumonia, and pneumococcal diseases. What disease does lyssavirus cause? A. Rabies, B. Diphtheria, C. Scabies, D. Poliomyelitis. And the correct answer is A. Rabies. Rabies is caused by a lyssavirus that affects the saliva and nervous system. Most cases of rabies in humans are caused by a bite or scratch from an infected animal. Millet seed-like shadows are seen in all parts of the lungs in which of the following disease condition? A. Extrapulmonary tuberculosis, B. Disseminated tuberculosis, C. Miliary tuberculosis, D. Tuberculous meningitis. And the correct answer is C. Miliary tuberculosis. The name miliary tuberculosis comes from a distinctive pattern seen on a chest radiograph. This chest X-ray will have many tiny spots distributed throughout the lung fields with the appearance similar to millet seeds. Thus the term miliary tuberculosis. Chloroquine is used for treatment of A. Diabetes, B. Malaria, C. Diphtheria, D. Tetanus. And the correct answer is B. Malaria. Chloroquine is used to prevent and treat malaria. Mastodynia is the term for A. Lump in breast, B. Pain in breast, C. Dimpling of breast skin, D. Fluid coming from nipple. And the correct answer is B. Pain in breast. Mastodynia is a medical term used for breast pain. Mastodynia is also called mastalgia. The life-saving golden hour for an accident victim to receive medical care is A. First 1 hour, B. First 2 hours, C. First 3 hours, D. First 4 hours. And the correct answer is A. First 1 hour. Golden hour is the first hour following a traumatic injury. This first hour has the highest likelihood of preventing death by providing prompt medical care. The most common occupational disease of computer professionals is A. Carpal tunnel syndrome, B. Dermatitis, C. Fibromyalgia, D. Pseudo-hypoparathyroidism. And the correct answer is A. Carpal tunnel syndrome. The most common occupational disease of computer professionals is carpal tunnel syndrome. Heat loss in a newborn can be prevented by all of the following except A. Immediate drying, B. Skin to skin contact, C. Keeping infants cot close to the windows, D. Breastfeeding. And the correct answer is C. Keeping infants cot close to the windows. Immediate drying, skin to skin contact and breastfeeding all helps to prevent heat loss in a newborn, whereas keeping infants cot close to the windows will only increase heat loss. Exclusive breastfeeding will save the baby by preventing all of the following except A. Diarrhea, B. Pneumonia, C. Malnutrition, D. Perfect nutrition. And the correct answer is D. Perfect nutrition. Diarrhea, pneumonia and malnutrition can be prevented by providing exclusive breastfeeding to the baby. Source of infection for neonatal tetanus is A. Use of unsterile instrument in cutting cord, B. Oral and throat secretions, C. Fecal-oral route, D. Direct contact. And the correct answer is A. Use of unsterile instrument in cutting cord. Use of unsterile instrument in cutting the umbilical cord is a source of infection for neonatal tetanus. TNM classification has been adopted by International Union for A. Stroke, B. Asthma, C. Diabetes, D. Cancer. And the correct answer is D. Cancer. TNM stands for tumor, nodes and metastasis. The TNM classification of malignant tumors is a globally recognized standard for classifying the extent of spread of cancer. All of the following drugs are used in the treatment of peptic ulcer except A. Pantoprazole, B. Omeprazole, C. Co-trimoxazole, D. Ranitidine. And the correct answer is C. Co-trimoxazole. Pantoprazole, omeprazole and ranitidine are all used in the treatment of peptic ulcer. Presence of sugar in urine is called A. Oliguria, B. Glycosuria, C. Hematuria, D. Pyuria. And the correct answer is drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.